Healthcare infrastructure is a major sector for the development of any state. Similarly, the generosity of healthcare officials is utmost important for the patients. IGM Hospital Agartala is one of the prime hospitals in Tripura wherein patients from every nook and corner of the state throng in for treatment. Most of the time, the IGM Hospital remains full of patients who expect better and advanced treatment facilities. But since a long time, the IGM Hospital Agartala has remained in the limelight with a number of allegations. This time, serious allegations has been raised against the medical superintendent of IGM Hospital Agartala, Dr. Amitabha Chakraborty, for his laxity in duty. After he has assumed the responsibility of medical superintendent, the IGM Hospital services has turned pathetic. No development has been done regarding the hospital services. Reportedly, an advanced machinery for CBCT, cone beam computed tomography, significant for medical diagnosis, has been purchased for high-end investigation of diseases and is better than X-ray. But till date, the machine has not been made usable. This is nothing but wastage of government money. Allegedly, there is shortage of trained technicians to operate such machines in the IGM hospital. Apart from that, people are being subjected to severe harassment while undergoing COVID test. A ticket counter has been set up in the new building, but as it's made of plastic, the workers have to suffer in extreme heat. There is no provision for washrooms and toilets for the doctors and healthcare workers. As a result, they have to suffer entire day during their working hours. Moreover, the Super Dr Amitabha Chakraborty uses abusive languages with the staffs, behaves rudely with the doctors and other healthcare workers. Because of this dereliction of duty of Medical Superintendent Dr. Amitabha Chakraborty, the development in the major government hospital of the state IGM has come to a standstill. There is even lack of adequate number of nurses and healthcare staffs in the hospital, which has in turn resulted into miseries of common man. Although the doctors, nurses or other healthcare staffs have spoken to the super about these hardships repeated times, but he has not taken any action in this regard yet. Because of his closeness to the chairman of IGM Hospital's Patient Welfare Association and MLA Dr. Dilip Kumar Das, Medical Superintendent Dr. Amitabha Chakraborty is running the hospital as his own property and doesn't feel any necessity to solve the issues within the hospital services. If these problems are not addressed immediately, the common people will have to face more complex problems in the near days. Because of IGM Hospital's Super Amitabha Chakraborty's delinquency, questions have started to raise in various quarters. Bureau Report, Hallabol.